Thank you. Good afternoon, ladies and gentlemen. My name is Grace, and I'm from China mainland. Today, I'm very honored and excited to deliver my presentation. Hopefully, this presentation help you know more about how the grassroots organization in China mainland help people with disabilities and the pandemic in China. Yeah. Please next PPT. Um, okay. Yes. Um, please next PPT. Next one. As we all know, how to say, I don't live in Hebei. It is a province that the number of people who got infected is the most. At the time, I still feel very frustrated and upset since I read plenty of news from internet, including good, bad. Actually, I failed to distinguish between true or false. I think I've done it, not to mention people in infected areas. I thought I should do something just in time. One of my friends called me and asked me whether I would like to join the network to help people with disabilities during the pandemic. I thought it was a super good idea, and then I joined. In fact, although a lot of organizations tried their best to help people in infected areas, such as giving food and masks, but failed of them focus on people with disabilities. We from this group and should do something for this group. Then the supporting people with disabilities network against pandemic was founded. As a matter of fact, at the beginning, we were not so clear what we should do, but we knew we should take some actions and we need more people to join us. So we post a flyer to encourage people to join us. Luckily, at the time, more than 200 people with and without disabilities said yes to us. Many of them are from angels, and they also use their platforms to help the network. So at least it exceeded 50 angels join the network, and these angels are reputable. In order to meet the needs of people with disabilities in infected needs, volunteers will choose a group based on their professions, and they will find professional groups. The first group is the research group. Though we could feel what people with disabilities need in infected areas from conversations with some friends. How can we know more people's needs and what on earth are their needs? So the research group took charge of survey. Terrorist coordinate group is to help applicants get their necessaries. Psychology group is to provide professional psychological support. Rehabilitation group is to help people with disabilities make rehabilitation based on domestic surroundings. The last group study sharing is to collect and recommend running resources. How did the group cooperate? Actually, it is vital that research group look for the needs. So research group make a questionnaire to collect the data. Just as I mentioned, grassroots organization help to promote the questionnaire and let people with disabilities to fill in the applicant form while we got the data. The volunteers of research group will call every applicant and write down their needs, then pass them to relevant group. For example, if applicant felt discourage and wanted psychology help, research groups pass them to psychological groups, support group. If applicants need by medicines or other necessaries or others, research group turn to materials coordinate group. This group would look for local volunteers for help. Some applicants stay at home too long and they felt very bored. The study sharing group recommend learning resources to them. All groups efforts. Finally, we have more than 200 people with disabilities in infected areas. Moreover, we also send some marks to them. Actually, at that time, marks are very expensive. What's more, we also got to contact a woman with disabilities who got infected during we made survey. Although our volunteers couldn't stay with her, we called her every day to encourage her and give her advices to obtain cures. Finally, this lady recovered and went back home happily. As we know, the need between people with and without disabilities is different. Female and male are also. Most members of the medical teams are female, but no one took their special needs into account, such as mania. Some NGOs focus on this problem and send feminine supplies to feminine medical cadres afterwards. A grassroots organization in Beijing that works at empowering women with disabilities also launched an activity, Love Women with Disabilities, under pandemic action. Why they would launch this action? Because COVID-19 made many women with disabilities lost their job. And also at the time, it's very difficult for them to go outside to buy some food or the feminine supplies. Maybe next PPT, please. Yes. Next one. Also next one. Yeah. Next one. Yeah, next one. There are three important parts during this action. Firstly, they raise money online, then open applicant to know how many women with disabilities need help. Last but not the least, they deliver the materials to the women. At last, they fundraise about 23,000 RMB online and help about 150 women with disabilities. However, the ways to help female are tailor-made. This organization will give money or send sanitary towel, nursing cushion, sanitary practice, etc., according to applicants' actual situation. Maybe 23,000 is not very much, but at the time it is special money to help women with disabilities. Actually, besides the network and this action, many grassroots organizations also contributed themselves to help people with disabilities by their ways. Especially, they provide hotline for psychology consultants. But in total, people with disabilities get less help during the pandemic. From this experience, I jot 4 pieces of thinkings and hope in the future our grassroots organization can get more resources against the risk. First, I think the government and more foundation can give more resources and support to grassroots organizations, since they know more about people with disabilities. They could truly help people with disabilities. Secondly, improve the system that the people with disabilities get their special medicines. Many people with disabilities have take their special medicine to keep their condition every day. But during that difficult time, people were forbidden to move out, and it's difficult or impossible for people with disabilities to buy their medicines. Not only because drugstores were closed, but also it's hard to get access to hospitals, pharmacies. Protecting people from COVID-19 very important, but it is vital to guarantee people with disabilities could get their medicines. Thirdly, bring people with disabilities into community and enable them fully get access to information and services. As I mentioned, there were several cadres in our community to serve locals. However, we found many people with disabilities didn't know they could turn to the cadres to buy food or medicines when research group talked to them. So people with disabilities know little about their communities, but it is not because they don't want. It is barrier-free facilities are not good enough. Therefore, communities should provide more accessible facilities and organize activities to promote inclusive and diverse consciousness so that people with disabilities can become a part of the community and get information and services. Last but not the least, women with disabilities' personal needs should be paid more attention. Most of community services are living goods, but women's physical condition is reasonable and also should get their feminine supplies. What we have done is not many, but we will persist in it. Now Chinese disability community are increasing active. They not only providing traditional service for people with disabilities, but also make good use of technologies to help people with disabilities command skills to earn their livings, such as live broadcast. People with disabilities have more opportunities nowadays in China. Yeah, that is my presentation. Thank you.